This procedure is done by all surgical technologists and surgeons before every surgical procedure. The objective of the surgical scrub is to remove soil and transient microbes from the hands and forearms, and to reduce the residual microbial count to as low a level as possible. The scrub must make sure that all jewelry is removed from hands and forearms before starting the scrub because jewelry is a reservoir for bacteria. The scrub must wear a clean hat and ensure that all hair is covered. The mask should fit snugly around the nose and mouth. We will be using the counted brush stroke method. In the stroke count method, each surface of the fingers, hands, and arms is scrubbed for a specific number of strokes. A stroke is considered as one back and forth movement. Scrubbing is performed using a circular motion and a pressure that is adequate to remove microorganisms without causing the skin to become irritated. We will use a methodical fashion for the scrub. This order should be followed every time the surgical scrub is performed. The first step is to turn on the water. Wet the hands and arms and perform a pre-scrub wash with antimicrobial soap. Grab the sterile brush and moisten the brush and work up a lather. Soak the fingertips and clean the spaces under the fingernails using the disposable plastic nail cleaner. Discard the file when you are complete. Lather the fingertips with the sponge side of the brush, then using the bristle side of the brush, start with 30 circular strokes to nails and fingertips. Then 20 strokes to all other surfaces, making sure to cover the 4 planes. Right now we are working on the fingers. After the finger, we move on to the palms of the hands. From the palms, we move on to the back of the hands. Lastly, we move up to the arms. While you are scrubbing the arms, ensure that you go about 2 inches above the elbows. This entire process is repeated on the other hand. Once you have completed the scrub, rinse the hands and arms without retracing or contaminating yourself by rinsing from fingertips to elbows. Allow the water to drip from your elbows before you enter the operating room. Once the scrub is complete, the scrub will move through the door backwards to avoid contaminating themselves. Slightly bend forward, pick up the hand towel from the top of the gown pack and step away from the table. Grasp the towel and open it. Do not allow the towel to touch any unsterile object or unsterile parts of your body. Hold your hands and your arms slightly above your elbow and keep your arms away from your body. Dry from the fingers to elbows in a rotating method, right and then left. Discard the towel into a receptacle. The scrub is only to touch the inside of the gown while putting it on. The scrub will keep his or her hands above their waist and away from their body at an angle of about 20 to 30 degrees. Gloves are packaged so that the scrub may don his gloves without contaminating the glove's outer surface. A package of gloves are packaged in an individual sterile wrapper. We will use the closed glove technique. Open the inner package containing the gloves and pick up one glove by the folded cuff edge with the sleeve-covered hand. Place the glove on the opposite gown sleeve, palm down, with the glove fingers pointing toward your shoulder. While holding the glove's cuff edge with one hand, grab the uppermost edge of the glove's cuff with the opposite hand. Take care not to expose the bare fingers while doing this. Continuing to grasp the glove, stretch the cuff over the gloved hand. Using the opposite sleeve-covered hand, grab both the glove cuff and sleeve cuff seam and pull the glove onto the hand. Pull any excessive amount of gown sleeve from the underneath of the cuff of the glove. Using the hand that is now gloved, put on the second hand in the same manner. When gloving is complete, no part of the skin has touched the outside surface of the gloves. Check to make sure that each gown cuff is secured and covered completely. Adjust the fingers of the glove as necessary so that they fit snugly. This is what a fully scrubbed, gowned, and gloved member of a surgical team looks like. The scrub will make sure that they do not place their hands above the shoulders or below the waist during surgery. This pose is an example of how you may stand in the operating room during surgery so as to not contaminate yourself.